Hello, our familiar colleagues. Let's start our ML Web Track 1, Group 7, entitled Professionalism. Our group advisor, Dr. Ghada Mansour, and from year 2, our colleagues, Dr. Lamia El Hassan and Dr. Amani Abdelmoula. From year 1, me, Dr. Salwa Morsi, and my dear colleagues, Dr. Hala Ibrahim and Dr. Nabila Gazor. Let's start our journey. Medicine is both a science and an art. Science that deals with what can be observed and measured, and usually a competent physician recognizes signs of illness and disease and knows how to restore good health. But scientific medicine only has its limits regarding culture, religion, rights, and responsibilities. So medicine is also an art involving application of medical science and technology to patients in families and the communities being served. Professionalism remains vague for many because it bridges two seemingly unconnected quantities: the evidence based science we learn and the emotional and psychological beings we touch. Professionalism is basis of medicine's contract with the society. It demands placing interests of patients above those of physicians, also setting and maintaining standards of competence and integrity, and also providing expert advice to society on matters of health. In general, professionalism can be defined as the attributes, behaviors, commitments, values, and goals that characterize a profession. And it is the habitual and just use of communication, knowledge, technical skills, clinical reasoning, emotions, values, and reflection in daily practice for the benefit of individuals and communities being served. In medical profession, it's slightly different because of its strong societal role and emotional component involved. Medicine remains a highly trusted profession in society, and with trust comes our responsibility. And usually, doctors must be mindful of their interactions inside and also outside their workplace. Medicine is seen as a vocation where a doctor's skills and knowledge are put to the service of patients in a partnership of mutual respect and accountability. And this is the moral contract that we said before, the contract between the society and the profession, in which each part has a duty to strengthen the system of healthcare they are bound by. In 2005, the Royal College of Physicians published a definition for medical professionalism as a set of values, behaviors, and relationships that underpins the trust the public has in doctors, and also identify the values and the behaviors that form the basis of society's trust. Values like integrity, altruism, continuous improvement, and excellence, and the behaviors like kindness, honesty, and confidentiality. So, professionalism can inspire, foster common identity, and act as a standards for acceptable behavior. Professionalism incorporates three coexisting commitments: patience, profession, and the wide community. Also, it involves three core skills: good clinical skills, good communication skills, and good management or leadership skills. All the above mentioned items are required in the pursuit of excellent patient services. Professionalism includes key elements like altruism, integrity and accountability, excellence, duty, honor, and respect for others. Let's talk about each one of them separately. The first one is called altruism, and altruism allows the medical profession to claim moral superiority, and it is often included in classical and modern definitions of medical professionals. The second one is integrity and accountability. Integrity is defined as encompassing honesty, keeping one's word, and constantly adhering to principles of professionalism, even when it is not easy to do so. Accountability usually refers to reliability and answering to those who trust us, including our patients, our colleagues, and the society in general. So, both are fundamental to ensuring trust between the public and healthcare professionals. Physicians' integrity forms a foundation for patients' trust and foster healthy therapeutic relationships that promote healing. Also, both form the basis of the social contract between the physician and the society. Both integrity and accountability are required at many levels: the level of individual patients, society, and also the profession. Lack of accountability in healthcare can cause significant damage to our organization. It may erode the quality of the care provided to the patients, ruin your organizational reputation, and even put patients' lives at risk. The third one is called excellence, and excellence is a terminology used to characterize medical quality in professionalism, which consists of principles and commitments to create relationships characterized by integrity, ethics, and teamwork with the goal of achieving excellence. Medical excellence involves more than compliance or automatically matching a disease with a drug. It's a philosophy of understanding the needs of a patient and putting those needs in context through the development of an individual treatment plan. The fourth one is duty, and duty refers to the free acceptance of a commitment to service. This entails being available and responsive when on call, accepting inconvenience and risk to meet needs of the patient, providing the best possible care regardless the ability to pay, and volunteering one's skills and expertise for community welfare. The fifth one is honor, and this is the highest standards of behavior and refusal to violate one's personal and professional codes. It includes being fair, truthful, and meeting commitments is essential. It also requires recognition of conflicts of interest and avoid relationships that allows personal gain to supersede best interest of the patient. The last one is respect for others. We must respect patients, families, nurses, medical students, and our colleagues. And this is the essence of humanism. Humanism, in turn, is central to professionalism and fundamental to enhancing collegiality among physicians. Thank you, my dear colleagues. Hoping you enjoyed our journey.